Dr. Miller here with Integrated Health of Indiana's Medical Minute, and we are continuing our blood work series. Today we're talking about chloride. So, as you saw on the short, if you saw the short, normal lab range is 97 to 107. Optimal, we tighten that up and we go from 100 to 106. Now, what causes hyperchloremia and hypochloremia, which is high chloride levels and low chloride levels? When we start to look at the high chloride levels, dehydration, kidney disorders, overuse of saline and of these salts that are coming out, and medications. So, we really don't want high chloride levels because that can induce vomiting and diarrhea because your body wants to get rid of it, and then it can take you too low. But you really have to watch these things because you do not want to be eating, like, well, we'll cover it on the next slide here, the bad sources. Let's go over the hypochloremia. If you're sick and you have vomiting and diarrhea, overhydration. This is something that we see with endurance athletes. If they don't use the salts while they're doing their big endurance programs, then they will start to get that overhydration and they will cause hypochloremia. And then last but not least are diuretics. People who take diuretics, so if they've got high blood pressure and issues like that, the diuretics cause them to pee a lot of that out. Now, for sources of chloride, if you are having issues with chloride too high, too low, or whatever, balance is always the key. And so your poor types of chloride are your processed and packaged foods. They use it a lot in salt so that the salt will cause you to, it has a lot of chloride in it. They use the salt in the packaged foods as a preservative, and they use a lot of it. And you just don't want that because it is hard on the kidneys and it is hard on the body. Your good sources that typically tend to be balanced are your seaweeds, your tomatoes, celery, olives, meat, eggs. And then we like to tell people, if you're having problems, use a little Celtic sea salt, just a pinch. This has all your minerals in there and has your chloride and everything else. This is just a good way to help you balance out your chloride levels. But once again, if you're having issues with your blood work and you want us to take a look at it to help you out, that's what we're here for. You can see the email on the wall. Hit us up and we're happy to help you heal or start healing from the inside out. There. Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.